CDC has seen an upward trend across the country of COVID-related illnesses and deaths. Here in Missouri, local health departments no longer have a COVID tracking dashboard, but testing is still going on. Chris Bryant is live in our newsroom with the testing that's underway and what it's showing. Chris?
Good afternoon, Lee. The most recent numbers from the Centers for Disease Control show that when it comes to emergency department visits, those are up 15% nearly, and 25% when it comes to hospitalizations across the country. In addition, there's been around a 17% increase in COVID-related deaths across the nation. Families will gather over the next week to celebrate the 4th of July. So, local health leaders want to remind you to take precautions to protect yourself and loved ones, not only from COVID, but other respiratory viruses as well.
Is good hygiene, hand washing, especially if you know you've been around someone or if you yourself have respiratory symptoms. Good hand washing and hygiene, critically important.
Well, Mercy Springfield says they have not seen an increase in visits to the ER.
We do still believe that there is some benefit in masking for those who are ill and might be projecting virus particles, be they COVID or others.
The sewer shed surveillance project started during the pandemic, and they took samples weekly from a variety of locations in the state at wastewater treatment plants. Even today, those weekly tests are still happening.
Slight increases, but we've been really low since the end of April. So it might not be unusual to see some slight increases after having a low period.
Currently in Missouri, they're keeping a close eye on the variants that are showing up.
Sublineages that we are seeing have been around from the beginning of the year with JN1 and another one called KP2 equivalent. It's been around since March. So we're not seeing a lot of new lineages out there.
While funding for the sewer shed project is in place for another 3 years, the testing can be used for other things as well.
CDC has expanded the list of different pathogens. I see us being able to do flu and RSV and a lot of other respiratory diseases.
For those who study and treat respiratory illness, COVID shed new light on an old problem.
Respiratory illnesses have been with us for a long time, and it wasn't until COVID a couple of years ago that it really heightened our awareness of the potential for severe respiratory complications.
Now, Mercy Springfield and the Centers for Disease Control recommend that you stay updated on your COVID and other vaccines as well, so that way you can keep yourself and your friends and family protected. In the newsroom, Chris Bryant, KY3 News.